The Janice Ward Center, a perfect location for your special event. Whether you are planning a business meeting, party, reception, shower, or other type of get-together, you may find the Janice Ward Center the ideal place to host the event. The building is located at 235 East Salem Street and offers the following amenities: the capacity of 80 people, on-site kitchen facilities, ample parking, air conditioning, tables and chairs. Please contact us at 937-836-3500 for available dates, rental rates, or any other questions that you may have.
Hello, I'm Paramedic Gooden with Clayton, and I'm going to go over the Easy-IO drill. There's a few things that we need to cover about the drill. First of all, you can only give it to somebody that is unresponsible or hemodynamically unstable, and that's about the only reason why you would give it to somebody. There's several parts to the drill. There's the actual drill itself, and then we have the needles, which just simply fit on there. There's a magnet that it fits right into. You're going to need a syringe, some saline, which we don't have right now, and a extension. There's two places that we're allowed to do it through the protocol. One is in the tubral tuberosity, and the other one is in the shoulder. We will say that this is the tubral tuberosity right here, which is 2 fingers below the knee, right there at the plateau there. The flat spot on the inside of the knee. Then you want to go 2 fingers in, and once you find that area, you swab it with alcohol prep. Insert the needle into the skin till you hit the bone, and then drill in. When you pull off, you take the drill spot off, and then you counterclockwise turn to extract the needle. You put your extension on, like so. Then you want to hook your syringe up, maybe. Of course, this one doesn't want to work, right? There we go. Then you want to extract. Once you see a bloody fluid, then you know you're in. Then you want to take this off. And then you would put your saline on, inject, and clear everything out. Put the stopcock on, and you'd get your 1,000 bag of saline out with your pressure infuser, and hook it up, and then start flowing and get ready to give your drugs as necessary.
Okay, today we're going to be going over CPAP, which is used for patients in respiratory distress. It's a positive pressure that helps air movement get it in deep into their lungs. So Mike is going to be our patient, Tyler's going to be helping out, and we're going to demonstrate the steps. Basically, this is used for people who are in respiratory distress. A lot of times they have pulmonary edema, which is fluid in their lungs. So what you're going to hear when you have a patient like this is you're going to hear kind of what we call wet lung sounds, where you can just hear them kind of fluid in the lungs. A lot of times they either have pulmonary edema or what is known as CHF, congestive heart failure. So if a patient has a history of CHF and they're having trouble breathing, a lot of times this is one of their major treatments that's going to help them out. So what we're going to do is we're probably going to be getting dispatched for respiratory distress. Mike's going to tell us that he is having a little bit of trouble breathing. Sometimes you need to use a stethoscope. Sometimes in severe cases it's so bad you can just hear it as soon as you walk in the door. So what you're going to do is listen to his lungs. You can hear fluid on both sides. One of the contraindications for using CPAP would be a pneumothorax, which means he's not getting air movement on either one side of his lungs. So you don't, if you're not hearing breath sounds on both sides, you might want to reassess the situation, make sure it's not something other than fluid in the lungs. But he's good, so we're hearing gurgling in his lungs. So we're going to go ahead and hook him up to CPAP to try to help him out. Basically, what he's doing over here is hooking the CPAP unit into an oxygen bottle. You can hear once you connect it, the oxygen is already on. Basically, what you do from this point is, this patient's going to help us out a little bit, but you put the mask up to the patient's face. You want this seal going from the bridge of the nose down to the chin, and it's really important that you get a good seal. So you're going to, if they can, that's great if the patient can hold the mask up to the face, but sometimes they can't. You might have to have somebody hold it for him. But he's going to help us out and hold it to his face. So what Tyler's doing is putting the head strap on. Basically, all this does is prevents Mike from having to hold the thing on his face the whole way to the hospital. So what you do is you want it tight, but not too tight. You don't want to make the person anxious, because they start getting too much anxiety from feeling like they can't breathe. That's going to screw the whole system up. So you want it tight enough to get a seal, but not tight enough to make them claustrophobic. So you can see he's doing the top straps first, get both sides tight, and you want it to be even too. You don't want to pull real tight on this side and kind of loose on this side, or else it'll kind of whopper jaw on their face. So once you get both of them tight, he can now let go of the mask. And you kind of want to make sure it's getting a seal. As you can see, Paul asked the patient if he was okay, make sure he's getting plenty of air movement. If they're real anxious, try to calm them down and try to tell them to take big, deep breaths. This is going to help, because a lot of people don't like the feeling of a mask on their face. So Mike said he's doing better. What you want to do is you want to assess his respirations now. Is he working harder to breathe? It should be a lot easier for him to breathe. So you should see his pulse ox going up, things like that. If he's not, sometimes what can help these patients is what we call a nebulizer, which is basically a breathing treatment of albuterol and Atrovent. And what it does is it just dilates all the vessels of the lungs, pretty much just opens them up. So if you need to run the CPAP and the nebulizer at the same time, it can be kind of tricky sometimes, but it can be done. So this right here that Tyler's holding is the nebulizer, and the bottom of it you would put your albuterol and Atrovent. This is just saline, since we're just demonstrating. So what you want to do is you want to connect that into the bottom of the blue tube here that comes in a kit. It actually comes in a kit to go with the CPAP. So once you do that, you connect. This also needs to have its own oxygen source, so it's connected to the oxygen bottle, as you can see down there. Once you do that, you're going to have to temporarily disconnect this mask here. Good. And he should still be able to breathe. It's just going to cut off the oxygen, but you can see he can still get air movement through there. And then that piece goes, the blue piece goes inside of the white tubing. Like that. Turn the bottle on. So then you want to turn the oxygen onto the nebulizer, and you can see the nebulizer here is actually, that's what it's supposed to do. It's supposed to aerate the medicine down there. So now he's getting the breathing treatment as well as the CPAP, which should really improve his condition. You still able to breathe? Is that helping you out a lot? As you can see, it helped this patient out. That's it.